What if the breakfast you trust every morning is the reason your blood sugar won't budge? I'm Dr. Richard Ben, and I've sat with hundreds of people who do everything right. They exercise, they watch portions, they skip dessert, and yet their numbers stay stubborn. Today I'm going to show you a simple, practical shift centered on one food most people already have at home: eggs. Use them the right way, and you can blunt post-meal glucose spikes, feel fuller longer, and even influence your fasting glucose the next morning. Try this change tomorrow and monitor your meters. But first, let's make sure you do it safely and effectively. If you want weekly, evidence-based diabetes tips, subscribe and turn on notifications. Stick with me for the next 20 minutes, and I'll take you through the why, the how, real patient examples, exact recipes, and the safety checks you must do with your healthcare team. I know how frustrating it is to be told, change your diet without clear, usable steps. So let's begin with the physiology in plain language. When you eat carbohydrates, bread, cereal, fruit juice, your body breaks them into glucose. In people with type 2 diabetes, that glucose moves into the bloodstream faster than insulin can clear it, creating that sharp post-meal spike. Think of carbohydrates as a car trying to speed down the highway. Protein acts like a brake. It slows the rate at which glucose appears in the blood, helping smooth the ride. Eggs are a particularly useful brake because they are a complete protein with a glycemic index of 0. They do not raise blood sugar when eaten alone. Beyond protein, eggs bring other nutrients that matter to people with diabetes: choline, which supports liver function, vitamin D, several B vitamins, and antioxidants like lutein and zeaxanthin that help eye health. For many years, people worried that the cholesterol inside egg yolks would worsen blood lipids. We now understand that for most people, dietary cholesterol has a much smaller impact on blood cholesterol than we once feared. The liver adapts its own cholesterol production. What tends to hurt lipid profiles more are refined sugars, trans fats, and persistent overeating of processed foods. That doesn't mean eggs are a free-for-all for everyone. Rather, they are a powerful, affordable tool to use intelligently. Let me be clear about limits. I will not promise that every person watching will see exact numerical improvements. Individual responses vary. If you use insulin or have significant kidney disease or other complex conditions, talk to your physician before making major changes. Metformin does not interact with dietary eggs. Insulin users, however, may need dose adjustments or timing changes when altering meal composition. I want to ground all of this in two real patient examples so you can see how this plays out in everyday life. These are individual cases to illustrate possibilities, not guarantees. One patient I worked with, I'll call them Daniel Emily, had been avoiding yolks and starting every morning with oatmeal and a small glass of juice. Despite trying to cut back on portions, Daniel's glucose would spike after breakfast to roughly 210 mg/dl. We swapped that breakfast for 2 whole eggs cooked without added oil, plus half an avocado and a generous handful of sautéed spinach and tomatoes. Daniel ate a thick slice of seeded whole-grain bread only after finishing the eggs. Over the next few weeks, the immediate post-breakfast glucose dropped into the mid-130s to 140s on many days, and after 3 months, Daniel's A1C fell from 8.2% to 7.5%. That is one person's result. Others may see smaller or larger changes, and timing matters. A1C reflects an average over about 3 months, so give any change some time. Another patient, James Taylor, typically fried his eggs in a substantial pool of oil and ate them with refried beans and tortillas. His fasting glucose in the morning was often around 178 mg/dl. After switching preparation, 2 eggs scrambled with a splash of water in a non-stick pan, lots of peppers and onions, and swapping the tortilla for half a slice of dense whole-grain bread eaten after the eggs. James's fasting values moved into the 145-155 range more consistently, and his A1C dropped to about 7.8% over a few months. Again, this is an individual example, not a universal promise. Those stories are encouraging because they show 2 things. First, preparation and pairings matter as much as the eggs themselves. Second, timing. What you eat at dinner and how you space meals can impact fasting numbers the next day. Now let's get practical. I will give you exact, replicable instructions for breakfast, for dinner, snacks, what to avoid, and how to monitor your response safely. Portion guidance and general rules. Aim for 2 to 3 whole eggs per day for most people without advanced kidney disease. This includes yolk and white together. If you have severe chronic kidney disease, speak with your nephrologist before increasing dietary protein. They may recommend a tailored plan. If you have an egg allergy, use alternatives: plain Greek yogurt, cottage cheese, or firm tofu scrambled with turmeric and vegetables. Keep the rest of the plate focused on non-starchy vegetables and healthy fats in small amounts. For example, half an avocado rather than a full one if you're controlling calories. If you take insulin, inform your clinician before making these changes and monitor your glucose closely. You may need dose timing or amount adjustments. Egg preparation methods that work. Boiled eggs. Do soft-boiled for a slightly runny yolk. Bring a pot of water to a gentle boil, lower in room-temperature eggs with a spoon, and simmer for 6 minutes. Remove and transfer to an ice bath for 1 minute, then peel. This gives a creamy yolk that pairs well with chopped herbs. Medium to firm yolk. Simmer for 8 minutes. Result, a firm white and a custardy yolk. Hard-boiled. Simmer for 9-10 minutes, then cool. Fully set yolk, easy to slice for salads or to carry as a snack. Scrambled eggs without oil, creamy, lower-fat technique. Crack 2 eggs into a bowl and whisk until uniform. Add a tablespoon of water or unsweetened almond milk for extra creaminess. Heat a good non-stick pan over low to medium-low heat. Pour the eggs in and let them sit for 10-20 seconds until the edges begin to set. With a silicone spatula, gently pull the set edges toward the center, letting uncooked egg flow under. Continue slowly, stirring every 10-20 seconds, until the eggs reach a soft, creamy texture, usually 2 to 3 minutes total. Remove from the heat while still slightly underdone. Residual heat will finish them. This method avoids frying in a lot of oil while producing a pleasing texture that helps with satiety. Vegetable omelette without oil. Beat 2 eggs with a pinch of salt. On a non-stick pan, at medium-low heat, add a tablespoon of water and quickly add chopped vegetables, spinach, tomatoes, peppers, mushrooms. Stir briefly until vegetables begin to wilt, about 30 to 60 seconds. Pour the eggs over the vegetables and cook gently until edges set, then fold in half. Cook until just set, about 2 to 3 minutes total. If needed, finish with a few drops of olive oil spray or a teaspoon of olive oil. Use sparingly. Poached eggs. Bring a shallow pan of water with a splash of vinegar to a simmer. Crack an egg into a small cup and slip it gently into the water. Cook for about 3 to 4 minutes for a soft yolk, longer if you prefer firm. Remove with a slotted spoon and drain on paper towel. Microwave hard-cooked alternative for when you're rushed. Pierce the bottom of the egg with a thumbtack once or twice. Place in a microwave-safe bowl with hot water covering the egg. Microwave on medium power for about 8 to 10 minutes total. Timing will vary by microwave. Then cool in ice water. Test once to ensure your microwave doesn't create pressure buildup. Use caution and lower power. Pairings that matter: what to eat with your eggs. Vegetables first. Fill at least half your plate with non-starchy vegetables: spinach, tomatoes, peppers, mushrooms, zucchini. Vegetables add fiber and volume without a big glucose load. Avocado. Half an avocado adds heart-healthy monounsaturated fat and helps slow gastric emptying. It's an ideal companion to eggs. Whole grain bread, but eat it after your eggs. If you want bread, choose a dense seeded whole grain slice and eat it after finishing the eggs. The rationale: letting protein and fat slow the earlier phase of digestion blunts the spike when the carbohydrate is finally eaten. Nuts as snacks. A small handful of nuts, about 15-20 grams or roughly a small handful, makes a good pairing or snack with a hard-boiled egg. Cottage cheese or plain Greek yogurt. If you cannot have avocado or need an alternative, a small serving, about 1/2 cup of low-sugar dairy, can replace some fat while providing extra protein. What to avoid pairing with eggs? Fruit juice. Even 100% juice can spike blood sugar quickly. Choose whole fruit if you want fruit, and pair it after the eggs if possible. White bread, bagels, sugary cereals. These fast carbs, eaten before or with eggs, reduce the benefit of the protein break. Processed meats. Bacon, sausage, and heavily processed deli meats often contain trans fats, added sodium, and other preservatives. If you want a protein boost, choose plain, minimally processed options like canned salmon or a few slices of turkey breast with no added sugars. Frying in large amounts of oil or butter, especially at high heat. Even healthy oils heated excessively can oxidize and create unhealthy compounds. Use a non-stick pan and minimal added fat, or an egg cooking method that avoids frying. Timing benefits. Why dinner eggs help fasting glucose. One reason fasting glucose improves after changing evening meals is hepatic glucose output. Overnight, your liver releases glucose to keep your brain and organs fueled. A dinner higher in protein and lower in refined carbohydrates can reduce the liver's drive to overproduce glucose at night. For many people, a high-protein dinner with eggs helps stabilize overnight glucose and can lead to a lower fasting number the next morning. Try one of these dinner templates: 2-egg vegetable omelette with a side salad, or scrambled eggs mixed into sautéed greens with a modest portion of whole grains eaten after the eggs. Practical breakfast recipes you can use tomorrow. Power breakfast number 1, the savory 2-egg plate. Ingredients: 2 whole eggs, 1/2 avocado, 1 cup spinach, 1/2 tomato, 1 slice dense whole grain bread. Optional. Prep: soft scramble the eggs in a non-stick pan with a tablespoon of water, 2 to 3 minutes. Quickly sauté spinach and tomato in the pan with residual heat or add them raw. Eat eggs and vegetables first. If you want bread, take 1 bite of bread only after you've eaten the eggs and vegetables. Why it works: protein plus fat plus fiber, slower glucose rise and greater fullness. Power breakfast number 2, boiled egg snack pack for busy mornings. Ingredients: 2 hard-boiled eggs, small handful of raw almonds, about 15-20 gram, 1/2 cup cherry tomatoes. Prep: hard-boil eggs for 9 to 10 minutes. Cool and peel. Pack in a container with nuts and tomatoes for on the go. Why it works: portable, stable glucose, and minimal preparation time. Power breakfast number 3, veggie omelette with cottage cheese. Ingredients: 2 eggs, 1/2 cup mixed vegetables, peppers, mushrooms, onions, 1/4 cup low-fat cottage cheese. Optional. Herbs. Prep: sauté vegetables briefly in a non-stick pan with a tablespoon of water, add beaten eggs, cook into an omelette, fold and top with cottage cheese. Why it works: adds protein, calcium and variety for people who prefer milder flavors. Dinner suggestion that targets fasting glucose, overnight stabilizing dinner. 2-egg vegetable frittata. Ingredients: 3 whole eggs, or 2 whole eggs, plus 1 egg white if you want slightly less yolk. 2 cups mixed greens and vegetables, 1/4 cup diced tomato, herbs, salt and pepper. Prep. Whisk eggs and pour over a pan of lightly wilted vegetables. Cook slowly until set. Finish in a low oven if needed. Eat with a side of raw vegetables or a small salad. If you include a grain, eat a small portion after the eggs. Why it works. Higher evening protein reduces overnight hepatic glucose output for many people. Smart snack ideas: hard-boiled egg, plus a small handful of nuts. Egg salad made with plain Greek yogurt instead of mayonnaise, eaten on cucumber slices. 1 egg folded into a blended vegetable soup to raise protein and increase satiety. Meal sequencing tip: eat protein and vegetables first, then any carbohydrates. This simple rule gives the protein a chance to blunt the immediate spike when you finally get to carbs. Monitoring your response. How to measure whether this works for you. Bean baseline. Before you change anything, track your current pattern for 3 to 7 days. Measure fasting glucose each morning and measure post-breakfast glucose at 1 hour and 2 hours after the meal for a few days, so you have a real picture of where you start. After starting eggs, test fasting glucose each morning and test post-breakfast at 1 and 2 hours for the first week. Compare averages, not single days. Expect variability. Some people notice a measurable change in 24 to 48 hours. More durable changes show up over weeks to months. A1C. Remember that A1C reflects roughly 3 months of average glucose. If you make consistent changes, expect to reassess A1C after about 8 to 12 weeks to see a trend. Keep a food log. Note what you ate, how the eggs were prepared, and your glucose readings. That way you can link specific behaviors to numbers. If you use continuous glucose monitoring, CGM, watch for the area under the curve after meals and overnight trends. If you use fingerstick testing, be consistent in timing and technique. Medication interactions and safety reminders. Metformin. No known interaction with eggs or these meal changes. Insulin. Changes in meal composition often require insulin dose or timing adjustments. Inform your prescribing clinician before you change meals. Monitor closely and be prepared to check more often during the transition. Sulfonylureas and meglitinides. These medications increase insulin action and also call for careful monitoring when you change meal timing or content. Kidney disease. If you have significant kidney impairment, your protein needs and limits may differ. Consult your nephrologist or dietitian before increasing daily egg intake. Food safety. Cook eggs thoroughly if you are older, immunocompromised, pregnant or otherwise at higher risk for foodborne illness. For the general adult population, soft-cooked eggs can be acceptable, but exercise caution. Allergies. Do not eat eggs if you have an egg allergy. Use the alternatives described earlier. Common mistakes I see and how to avoid them. Mistake: frying eggs in a lot of butter or oil and pairing with a sugary drink. Why it fails. The fat and processed sides add calories and unhealthy compounds, while the sugary drink wipes out the protein benefit and spikes glucose. Solution: use a non-stick pan and cook with water or minimal oil, pair with vegetables, and skip the juice. Mistake: eating a bowl of cereal or toast before the eggs or instead of protein. Why it fails. Starting the meal with fast carbs spikes glucose quickly. Solution: start with eggs and vegetables. If you want carbs, save them for later in the meal after protein. Mistake: over-relying on processed egg products, prepackaged egg patties with fillers. Why it fails. Many prepackaged options contain added starches, sugars, or sodium. Solution: use whole eggs prepared simply, or make an egg muffin at home with vegetables and minimal added starch. Egg quality. Does it matter? Pasture-raised or organic eggs can have a slightly different nutrient profile, including more omega-3s and fat-soluble vitamins, and some people prefer them for animal welfare reasons. If you can afford pasture-raised eggs, they are a fine choice. Conventional eggs remain a highly nutritious and affordable option. The most important factor is how you prepare them and what you eat with them. Cost and accessibility. One reason eggs are a practical tool is affordability. In many places, eggs are one of the least expensive, high-quality protein sources. You can build a week's worth of breakfasts around 2 eggs plus inexpensive vegetables like spinach, tomatoes, and peppers. A week-long sample plan to get started. Repeat and adapt as needed. Day 1, breakfast. 2 soft scrambled eggs with spinach and tomato. Eat a slice of seeded bread after eggs if desired. Dinner, vegetable frittata with a side salad. Day 2, breakfast. 2 hard-boiled eggs, small handful of almonds, cherry tomatoes. Dinner, scrambled eggs with sautéed kale and mushrooms. Day 3, breakfast. Omelette with peppers and onions, half an avocado. Dinner, mixed green salad topped with sliced boiled egg and grilled chicken if you want meat. Day 4, breakfast. Egg and cottage cheese scramble with herbs. Dinner, egg-stuffed bell peppers, bake eggs into halved peppers. Day 5, breakfast. 2 eggs poached on a bed of wilted spinach, 1 small slice whole-grain bread after eggs. Dinner, vegetable soup with an egg stirred in at the end. Day 6, breakfast. Egg muffin cups made with eggs, broccoli, and a sprinkle of cheese served cold or warmed. Dinner, omelette with tomato and basil. Day 7, breakfast. Boiled eggs with avocado and sliced cucumber. Dinner, light dinner focused on vegetables and 1 egg-based dish. Pairings and substitutions for special situations. If you need fewer calories, use 2 eggs and bulk up on non-starchy vegetables. If you need more protein, for example post-exercise, add a small portion of lean protein later in the meal, rather than adding processed sides. For lactose intolerance or dairy sensitivity, skip cheese and use herbs and vegetables for flavor. For nut allergies, substitute seeds, pumpkin or sunflower, in small amounts for crunch. What you might notice and what to do: hunger. Many people report feeling fuller for 4-5 hours after a protein and vegetable breakfast, which can reduce snacking and overall calories. Glucose patterns. Some people notice a lower 1-2 hour post-breakfast spike within a day or two. Others need a few weeks. If you see no change after 2 weeks, review your portion sizes, preparation methods and pairings, and consider reviewing with a dietitian. Weight changes. Higher protein meals can modestly decrease caloric intake by increasing satiety, which may lead to gradual weight changes over time. Weight loss, if it occurs, supports glucose control, but is not guaranteed. Troubleshooting common scenarios. If your post-breakfast numbers stay high despite making these changes, check 3 things: portion sizes, hidden carbohydrates, sauces, condiments, and whether you're truly waiting to eat bread until after the eggs. If everything looks correct, share your logs with your clinician for medication review. If your fasting glucose worsens after adding an egg-heavy dinner, reassess the carbohydrate content of your dinner and the timing. Some people respond better to an earlier dinner, others to a lighter carbohydrate intake at night. If you're using insulin and notice unexplained lows after changing your meals, contact your prescribing clinician promptly for dose adjustment. Behavioral tips for lasting change. Start simple. Pick 1 breakfast style you enjoy and commit to it for 2 weeks. Simple consistency beats sporadic perfection. Meal prep. Hard boil a few eggs at the beginning of the week for quick access. Make a batch of chopped vegetables to add to scrambled eggs every morning. Keep snacks simple and protein forward to avoid late-day high-carb cravings. Track. Write down what you eat and the associated glucose values for at least a week before and after the change. Data makes decisions clearer. A few FAQs I hear often. Q. Will whole eggs raise my cholesterol? A. For most people, eating 2 to 3 whole eggs per day does not significantly worsen blood cholesterol in the context of an overall healthy diet. Dietary cholesterol impacts individuals differently. Focus on reducing refined sugars and trans fats first. If you have a specific lipid disorder, ask your clinician for individualized guidance. Q. Can I eat eggs every day? Yes, many people can safely eat eggs daily. The common recommendation in our guidance is 2 to 3 whole eggs per day for most people without severe kidney disease. Always personalize with your healthcare team. Q. Is it better to eat egg whites only? A. Egg whites provide protein without fat or cholesterol, but the yolk contains vitamins and minerals that are beneficial. Eating whole eggs gives you a more complete nutrient package and may produce better satiety. For those advised to limit cholesterol or calories, mixing whole eggs with extra whites is an option. Q. What if I don't like eggs? A. Use other high-protein breakfasts: Greek yogurt, plain, low-sugar cottage cheese, tofu scramble, or lean fish. The key principle is protein first and carbohydrates later. Final reinforcement and action plan. You can transform your diet by using eggs the right way. Start tomorrow with this simple testable step. Have 2 whole eggs prepared without frying in heavy oil. Pair them with vegetables and half an avocado or a small portion of cottage cheese. And if you want bread, eat it only after finishing the eggs. Monitor your fasting glucose the next morning and check a post-breakfast value at 1 hour and 2 hours on a couple of days that week. Keep a short food and glucose log and share it with your clinician at your next visit. Remember, make changes one at a time, track results, and stay in communication with your healthcare team, especially if you take insulin or have significant kidney disease. Metformin does not interact with eggs, but insulin adjustments may be necessary. If you try this tomorrow, give it a fair trial for a few weeks and watch both your daily glucose pattern and your overall sense of hunger and energy. Small, specific changes like this often compound into meaningful improvements. If this message helped, please like and share the video so others with diabetes can learn a practical approach. Tell me in the comments, how do you usually prepare your eggs, and which change will you try tomorrow? And most importantly, check with your doctor if you take insulin or have other medical conditions before making significant dietary changes. You don't need to overhaul everything at once. Start with the plate in front of you tomorrow morning. Use eggs as the centerpiece rather than the afterthought, and see how your numbers respond. Small, consistent choices add up.